Tests. Once breast cancer is diagnosed, there are certain tests to check the extent of cancer. These tests may be CBC and tests to show how kidney, liver is working, PET scan, bone scan, CT scan, MRI, etc. Treatment. Breast cancer is treated in several ways. It depends on the kind of breast cancer and how far it has spread. Breast cancer treatment often requires surgery to remove cancer. Most people with breast cancer will have other treatment after surgery like radiation therapy, chemotherapy, hormone therapy, targeted therapy, immunotherapy, etc. Doctors combine treatments to minimize the chances of the cancer coming back, recurrence. Some people may have chemotherapy or hormone therapy before surgery to shrink the cancer and make it easy to remove. Surgeries may include as lumpectomy, also referred to as breast conserving surgery or wide local excision. The surgeon removes the breast cancer cells and a small margin of surrounding healthy tissue. A lumpectomy may be recommended for removing smaller tumors. For larger tumors, patients may have to undergo chemotherapy to shrink the tumor to make it possible to remove it by a lumpectomy procedure. Mastectomy means removal of all breast tissue completely. Most mastectomy procedures remove the ducts, lobules, fatty tissue and some skin, nipple and areola. Newer surgical techniques such as skin-sparing mastectomy and nipple-sparing mastectomy are increasingly becoming common. Some women may also have both breasts removed. Double mastectomy. Sentinel node biopsy. Lymph nodes are removed as they are the first to receive the lymph drainage from the tumor to determine whether cancer has spread to the lymph nodes. If the tests are negative, no other nodes will need to be removed as there is very little chance of finding cancer in any of the remaining nodes. Axillary lymph node dissection. In case cancer is found in the sentinel lymph nodes, the surgeon will remove additional lymph nodes. Contralateral prophylactic mastectomy. Some women with breast cancer in one breast may choose contralateral prophylactic mastectomy because of genetic or strong family history. This surgery removes other healthy breast to lower risk of developing breast cancer again. Chemotherapy is the use of drugs to destroy cancer cells, usually by keeping the cancer cells from growing, dividing, and making more cells. It is given before or after surgery. Before surgery helps to shrink cancer cells so that it is easily removed. After surgery kills cancer cells. Chemotherapy may also cause side effects depend on which medicines is given. Radiation therapy is a powerful energy beams. Radiation therapy is the use of high-energy X-rays or other particles to kill cancer cells. People who have breast surgery often receive radiation therapy to kill any type of cancer cell which is left after surgery. Radiation therapy can cause side effects which might be short-term or long-term, or sometimes some serious problem may occur. Hormonal therapy, also called endocrine therapy, is an effective treatment for many tumors that test positive for either estrogen receptors, ER, or progesterone receptors, PR. Hormone therapy uses medicines to either lower the amount of certain hormones in the body or block certain hormones from getting to breast cancer cells. Hormone therapy may be used before surgery, helps make the cancer smaller, or after surgery, lowers the chance of cancer coming again. Hormonal therapy may also cause side effects depend on which medicines is given. Targeted therapy kills cancer cells. It is the treatment that targets the genetics changes that turn healthy cell into cancer cells. The most common targeted therapy medicines for breast cancer target the protein HER2. Some breast cancer cells make extra HER2. This protein helps the cancer cells grow and survive. Targeted therapy medicine attacks the cells that are making extra HER2 and doesn't hurt healthy cells. Targeted therapy may be used before surgery, helps make the cancer smaller, or after surgery, lowers the chance of cancer coming again. Immunotherapy is a treatment that helps to fight cancer cells by boosting immune system. Immunotherapy helps the immune system cells find and kill the cancer cells. Immunotherapy may be an option for treating triple-negative breast cancer. Triple-negative breast cancer means that the cancer cells don't have receptors for estrogen, progesterone or HER2. There are many clinical trials evaluating immunotherapy as a way to treat different types of breast cancer. Palliative care, as per WHO, palliative care improves the quality of life of patients and that of their families who are facing challenges associated with life-threatening illness, whether physical, psychological, social or spiritual. The quality of life of caregivers improves as well. Palliative treatment can relieve pain and help manage other symptoms. Treatment may include radiotherapy, chemotherapy or other drug therapies. Breast self-examination. BSc women should begin breast self-exam every month after the age of 20 and continue almost throughout their lives, even during pregnancy and after menopause. In the shower, using the pads of your fingers, check the entire breast and armpit area. Check both the breasts every month and see if there are any lumps, hard-feeling knots, thickenings or any other breast changes. In front of a mirror, stand in front of mirror and check your breasts with your arms by your sides. And then repeat with arms overhead. Look for any changes in the breast shape, changes in the nipples, breast swelling or dimpling of the skin. Flex your chest and look again for dimpling, puckering or changes. Make sure to look at both the breasts. Lying down. While lying down, breast tissue spreads out, making it thinner and easier to feel. Put a pillow under your right shoulder. Place your right arm behind your head. Use your left hand and move the pads of your middle fingers, then press all parts of the breast and armpit and check if there are lumps, thickening, hard knots or any other changes. Also squeeze the nipple so to check for discharge. Repeat all these steps for left breast also. Don't rush. It may take several minutes to carefully examine your breasts, so don't make any kind of rush. Thank you for watching my video. For more videos, kindly like, share and